that moment. I will say that, since COVID-19, all of the healthcare systems, the hospitals specifically in terms of emergency utilization, has come down quite significantly. And only those individuals that require acute emergency care are actually coming to the hospitals. Others are, of course, accessing care through other means, including urgent care centers, which is really good to hear.
Yeah. Looks like we have a call or a text message or something, some kind of a question, right, Tara?
Yeah, so John from Cupertino has texted, I'm confused why California is opening up when the first wave hasn't even subsided. What are your thoughts on things reopening when the first wave of COVID-19 is still not done?
That's a great question, Paul. I'm gonna let you give your opinion on how things are going in that regard. There was just a great report that came out that was published this morning in some of the national media talking about how of the states that have opened up to some degree, which is most, they're split about half. There's about 23 states that have opened up to some degree that are having surges and spikes and problems, and hospitals are starting to fill up. And then there's about 24 that an equal number that are staying kind of flat. Interestingly, we're having a little bit of, we talked about our numbers here. They're not going down. We're still, deaths are increasing. Things are still happening. What's going on and how strict? Obviously, it's Sarah Cody's call, not yours or not mine. But how strict do you think she's going to need to be in the coming weeks? And what's your opinion on that?
Well, I think what people need to have is some perspective of from community to community. You see different levels of spread with respect to COVID-19. In the Bay Area, I think we started out really well in terms of making sure that we got ahead of it. And we stayed ahead of it. People were not comfortable that we were still holding on to the shelter in place for such a long time. And then we started to ease up on that based on what we were seeing. I think from the perspective of, from a public health perspective, looking at the numbers, they were comfortable to start relaxing the shelter in place. And they will continue to relax it depending on what they see relative to some of the data that they're collecting. What we do know, I can tell you, is that if you look at Southern California, you're starting to see an increasing number of cases, increasing number of hospitalizations. And in fact, I can tell you that from a county emergency management standpoint, there are parts of the state of California, Imperial County, et cetera, that are having difficulty in managing hospitalized patients. And they're shifting patients to other hospitals and even asking for help from Northern California hospitals. So this really is a very community-specific type of issue. But at the same time, it does know no boundaries.
Right.
It goes beyond that. And I think that is a legitimate concern, and that's something people should be worried about.
Yeah, it was just, I'm glad you kind of stopped at that point, because what's going through my mind is just yesterday, I had the great honor, along with some other officials, county officials, regional officials, to cut the ribbon on a new BART station here in San Jose at Berryessa, and another gorgeous new BART station in Milpitas. Beautiful, right across the street from a light rail station, so it basically connects. People could get on the light rail in South San Jose, go to the Milpitas station, end up in San Francisco or anywhere between. In fact, yesterday we had officials, workers, even just BART employees from all over the Bay Area converged on Santa Clara County. Now, I know that Alameda's numbers are not as flat, or not flat at all like ours. They're increasing, at least in terms of the number of positives, the number of infections, their hospital rate, and that's on one side of us. I mean, from Milpitas Station, that's a hop and a skip to Alameda County. You just cross there over into Fremont, and you're in Alameda. The next station on BART is Fremont. So you got people traveling back and forth, and then San Mateo similarly has numbers going up. How does that play into the thinking of the Emergency Operations Center in our county, as people say to us? I hear it all the time from constituents, we've done our job, we've done a great job, thank you, Sarah Cody, but our numbers are low. Let us open up wide open. What's the big deal? And I wonder how much concern there is about people moving back and forth across boundaries.
There is deep concern. We're a very transient community in society. We know summertime people are getting a little bit antsy and really wanting to get out and do more. But I think the CDC, the Public Health Department, is once again reminding people, don't let your guard down. Continue to make sure you take the appropriate precautions. And look, it really does come down to individual responsibility. Government, we can put rules and guidelines in place, but it is only as good as the individuals that actually pay attention and take heed of those warnings. I will say that we are watching the numbers very closely in the healthcare community. We're looking at what's going to happen the next 2 weeks relative to hospitalizations, given what we're seeing in the community and what we're observing. And I think you don't have to go far to walk out your front door or drive down a freeway into a community to realize that it's not as, how can I put it? It's not as comforting as we were maybe 2 weeks ago
Sure.
in terms of people's attentiveness to this issue.
Yep. Yeah. No, I know that people are getting impatient. Being an elected official who has to go to places like the county building or the BART station or to some other official county duties, I'm like you. I'm considered an essential worker. I'm supposed to go do my job as a government official, but I hear things along the way. And just 2 days ago, I heard two women who apparently had never met each other before, one wearing a mask and one wasn't. And they were in front of a retail store, and the one with the mask on looked at the other woman and took her mask off. And she said in a very loud voice, she said, "I'm sick of this. I'm taking my mask off like you. I've been doing this long enough. I can't take it anymore." And it shows the power of the ability for people to sort of unvolunteer. There's no way the police or the district attorney or anyone can go around enforcing masks on 2 million people. And if the peer pressure starts to let down, because as you alluded, you're around and you see less people doing it, or protesters not doing it, or police officers not doing it, at some point, does it erode one of the best tools that we have? Talking about studies, I read another study early this morning that said that, and I think the CDC came out with this directive that said our number one tool right now is the mask, that they have studied now long enough the interaction of people in close proximity to be able to determine that where masks were mandated on people with close proximity, even where people were testing positive, they weren't spreading it to somebody right next to them. It's sort of the reverse of contact tracing. They were saying there was interaction, but there's nothing to trace. And the only thing they can attribute that to is the mask at that point. So it's a big deal. It's a big deal for people to try to be patient and continue to comply. That's my opinion. I suspect yours is similar.
I would absolutely agree with that. And as we're talking about testing and obviously and the importance of masks, the other comment I think people have been around, what is the county doing around the follow-up when someone tests positive, which is the contact tracing. And that in itself, another public health measure that will hopefully help contain. But if you think about how that works, the contact tracing starts with, index case, and of course, the close contacts and those reviews. And as much as the county is doing a phenomenal job in bringing together these contact tracing teams, it's also very important to keep the number of cases low.
Yes.
So that they're able to manage that contact tracing to the point in which it is effective. And I think it will be a telltale sign over here in the next couple of weeks of whether or not we see a rise in the number of cases and our ability to keep up with the contact tracing necessary to further contain it. Because we're supposed to be in a containment mode right now of COVID-19. And the question is that how well are we going to be able to do that? And it is only as good as our ability to follow the guidance given by the Public Health Department.
Well, Paul Lawrence is the CEO of a huge health and hospital system here in the county. I guess you get some responsibility for all these things, everything from testing to contact tracing to making sure your own employees or frontline workers aren't getting sick. We'll talk about that before the hour is over. Tara, did you get another question for us?
Yes. Rinky on Facebook asks, what is the plan for allowing Santa Clara County employees to return to work? Her being one of them, she says. Is there a timeline?
For county employees to return to work, many of the county employees are essential workers, so they're already working. Let's make that clear. The county has 22,000 employees, and it's a big, at times we're the largest employer. We, as a member of the Board of Supervisors, I can say this, are the largest employer in the county, including our tech companies, our largest tech companies. So it's a big operation that ordinarily has about an $8 billion budget, although budgets are shrinking right now because of lack of tax revenue, because the economy's been shut down for a while. Health and hospital, there's almost all essential employees, and it's almost half of the county's workforce is tied up just in this health and hospital system. People, I assume, like our office, every other department where there are non-essential workers, there are people who are working remotely to some degree. And beyond that, I don't know. I think you could probably answer her question better than I could.
Well, I would first start out by saying that, the county and the county executive, under his leadership and support from the board, really promoted telework.
Mm-hmm.
And, for those activities and duties that could be done at home, I think we all understand the importance of that.
Mm-hmm.
It protects the employees, it protects others from further exposure. There's less worry about an employee going to work, having contact with other people, and then coming back home to a family. And we all know that workers are always concerned, particularly in healthcare, about coming back home. Mm-hmm. And further exposing other members, especially members that, may be at risk for some reason or another. So I think the county has done a really good job, and so have many other business in the Silicon Valley, to make sure that they promoted telework. The importance of that can't be underestimated and understated. But beyond that, we are an organization that is service-oriented, and in many instances we have to be at a particular facility providing health care. There needs to be support staff to make sure that the facilities are maintained. So there is a large contingency of a workforce that is coming to work every day and providing the care and services that are needed. And it's just not in healthcare. It's throughout the county of Santa Clara in the departments. The other thing that I would I'd be remiss in not mentioning is that as we loosen the shelter in place, that doesn't necessarily mean that those individuals have to come back to work. I think it's important to maintain, the telework,
right,
and find that right balance, because we are all searching for the quote unquote the new norm within business, and it's no different in healthcare.
Yeah, the county itself, the Board of Supervisors, recently directed the county executive, Dr. Jeff Smith, to try to maximize telecommuting going forward. So in the sense of coming back to the building, I guess the answer is some people may never come back full-time. They may have a 1 day in and 4 days by telecommuting, or some kind of a new schedule. That's all still being analyzed, and I'm sure we'll have answers in the next couple of weeks. Tara, you got something else for us?
Yeah, so we have a question texted in. I'm also interested to hear what you and the county think about other counties and states opening up and the impact it could have on us.
Yeah, we were just talking about that in a couple different ways. One, the jury is still out in terms of the openings, how they are leading to more infections or not. We opened up on June 5th, just 8 days ago. We opened up 13 new activities or employment types of employment, manufacturing, in-house retail, malls, things like that. My understanding is we got a little bit more time before we see how that's going to move our numbers here in Santa Clara County. But she seems to be asking also about this issue of people moving around, whether they're flying in and out or taking the BART train in and out. If they're asymptomatic, Paul, how much of a worry is it that somebody's going to get on that BART train, get off on Berryessa, tell their boss, I don't need to telecommute anymore because BART will take me right to San Jose, and I want to take the train down and go do my job down there. What if they're an asymptomatic carrier? Again, how much do we need to worry about not being able to pick up on who's infected and who's not?
Yeah, it's somewhat counterintuitive if you think about it, when you have counties that are so close to each other, yet the shelter in place, the relaxing of the orders are very different.
Yep.
Particularly in that we're so transient, and you talk about transportation. And I would probably say that, and this has been said by the health officer and the county executive, which is why it is so important that we get testing much more available in the community, and why people take advantage of that, particularly those individuals that are in close contact and regular contact with the general public, that they do get tested. And so we can get a sense of the prevalence in the community of whether or not it's changing. You gave the statistic, which is we're down to 3.2% now from a high of around 11%. Where is that number going to go? It will really be dependent on how much testing we do and how much we're able to monitor the exposure rate within the community. And that's our only really defense to this, if you think about it. In the end, people want a vaccine. It's not anywhere in sight, although people speculate that maybe early 2021, but that's still a ways off. A lot can happen given the nature of COVID-19 and its ability to spread rapidly.
So, we were talking about this a little bit last week, and if you have 3% positive tests, it strikes me as a low number. It strikes a lot of people as a low number. But if 100 people come in, and I want to follow this thread, this question a little bit more. 100 people come in on the BART train, which is a low number for BART, right? I'm just using that as an example. It means that if they all got tested, this is the way I understand it, that we'd have low single-digit positives, but we'd still have some positives. It means that if all those folks came in from Alameda to Santa Clara County, that we just had arrive on that train, 3 out of 100 people walking around symptomatic, contagious, right? So at some point, do we, again, it's Dr. Sarah Cody's call in the final analysis, but at some point as a hospital administrator, do you say, maybe we need to start testing people who are going to be coming back and forth across county lines? They screen people now before they get on an airplane and ask them a ton of questions about how well they are. Do we need to do that for commuters too?
Well, I think the more recent public health order made it very clear that people that come in contact with a large number of people need to be tested. Mm-hmm. That's one of the
regardless of where they're coming from.
Regardless of whether or not they participate in a protest of 50 or 100 people, they should get tested. And as much as people are wearing the mask, we all understand that's not just a mask where you have the exposure risk. And so I think it's really important that there's a reason the public health officer puts out the order in the way in which she does as she relaxes the shelter in place. Those 3 individuals out of 100, just imagine the number of people that those 3 individuals came in contact of that 100, and then prior to that and subsequent to that. within 24 hours.
And on the way home again.
No way home again. So 3, if you ask me, given the nature of COVID, it is a big number still.
And Tara, do we have another question? Oh, sorry.
I have quite a few, and Nina and Lawrence asked similar questions, so I'll just join them. I'm interested in how to manage college students living on campus, keeping them and others in contact with them safe. Lecture classes are currently planned to be virtual, but the plan is also to have classes that need to be done in person in a socially distanced way. Especially with the new school year being few months away, how will schools in the area be able to reopen safely?
Paul Lawrence, our hospital CEO, I'm going to let you answer this one, but I will say, look, son, don't know the answer exactly, and I'm biased because I have 4 children, and the youngest is a student at UCSC, and so he's going to go back into this environment, however they shape it. What are we looking at there? What do you think is going to happen? Obviously, the schools want to open up by fall.
Well, I think, whether we're talking about schools or any situation where individuals don't have the ability to social distance and protect themselves and protect others, there is a level of concern, there's no doubt. Particularly when we talk about individuals that are very young, very active, very involved in the community, that it's going to be a challenge for us. And if you think about our society and the number of individuals that are students, whether in college or in high school, it's a big part of our community. I think to some extent most of the universities and the colleges are paying very close attention to the recommendations and how best to utilize I'm not sure what they're calling teleschooling,
Distance learning.
Distance learning.
Distance learning, yeah.
They're using it to their advantage, and I think the challenge though there is that many students and many young people really want that experience of being in college and being around other people.
It makes a lot of
But
difference.
that's going to have to be a sacrifice, and realize that in the short term here, we all have to do our part.
So before we go to the next question, and it's I have to remind myself of this all the time, and I find myself reminding business people of this because business people are so much dependent on the number of people they can congregate, whether it's a restaurant or a dentist or anyone else, is that even if the public health officer opened everything wide open, the UC system and this Cal State system would still have the responsibility of 6 feet apart under state rules, right? Reduced capacities per square footage, and then they'd still have their own concerns and their own sense of liability. Do we really want to pack students into an auditorium when we, as academia, know that the medicine and the science says if we do that, our students are going to get sick? So I know a lot of pressure on the public health official, but she's not the only one that's sort of regulating all of this, and all over the state these questions are going to be dealt with over the next couple of months. Well, Tara, you said we have some more.
So I'm going to combine a couple again. Juanita asks, what medical assistance is there for people who get COVID-19? And we had a texter ask, do we have enough PPE if we see another uptick?
Oh, great. These two questions figured out that we have Paul Lawrence here from the hospital system, so these are all yours.
Thank you, Supervisor. So with respect to healthcare in general, and then of course COVID-19, irrespective of your healthcare need, I think we're very fortunate in Santa Clara County that we do have a comprehensive healthcare system, a public system that complements the Kaisers, the Stanfords, the other community hospitals out there. So, to a large degree in Santa Clara County, if you need health care, you can get health care. If you do not have a health care provider, we're more than happy to make sure that you get connected with a primary care provider, a physician, and then they can guide your health care and your needs relative to whether it's related to COVID-19 or any other health care need.
And what does treatment look like these days? I mean, early on, there were respirators they were even in short supply, and then people were talking about, I'm talking about for your ICU folks, and then there was some talk about needing double respirators, and then there was some talk about maybe that's not the best treatment. I know you're not, zoomed in on the medicine side every day because you're the hospital CEO. But what is the day in the life of a patient coming in, or is it all different because they're exhibiting different symptoms these days?
Well, let me kind of answer that in a couple different ways. One, the caller, the texter, asked a question about PPE
And medicine. And treatment. Yeah.
So from a personal protective equipment standpoint, we have adequate supplies
Good.
within our county healthcare system and all the hospitals. We work very closely with the County Emergency Operations Center. We update them relative to our 30-day supply of PPE, and we certify that we have enough on hand to make sure that we're able to care for our patients. And within that, you have to understand as we opened up healthcare and made sure that people are reminded they need to come in for healthcare. They can't put off their healthcare needs. Otherwise, we're going to have other challenges in the community.
Right.
People with chronic conditions not getting their medication, they need to come in. And so we've been encouraging that. And as we've been encouraging it over the past several weeks, we have seen an increase in the number of patients that are coming to our hospitals. Not just the county healthcare system, but other hospitals throughout Santa Clara County, which is good news. But that also means that when those patients come in, we have to make sure that we take the appropriate precautions relative to protecting them and protecting our healthcare workers. So we've gone to extraordinary lengths to make sure that they have the appropriate PPE, the environment is conducive to maintaining social distancing, that the environment is clean on a regular basis. And then on top of it, there are certain types of procedures in cases where we make sure that the individual patient is not exhibiting symptoms, and if they are, we're testing. And we're even testing individuals that are asymptomatic that may be coming in for an elective procedure. So we're not only is the county system making sure that we're taking care of our patients, taking care of our staff, but every other hospital is paying very close attention to that.
Yeah, I know you've had to have a very high level of scrutiny in terms of protecting nurses and doctors and other frontline workers in the hospital, and you've been successful thus far, but I'm sure that's where the question was coming from in terms of PPEs, and there must be a bunch of other things that you're doing to protect those workers as well.
Well, I can tell you, Supervisor, that early on, and I think all you had to do is follow the news, healthcare workers were very concerned about their own personal health and the protection that
Yes.
their employers were affording them, not only for their own individual health, but many of our healthcare workers go home and take care of others,
Yeah.
right?
Right.
And so to a large degree, we did our best to make sure that we provided the appropriate PPE, we provided the appropriate training and support, and it I think has played out in some light relative to some of the numbers, in that we've done a good job. We can always do better, but I think we've done a good job. So we've tested all of our employees in our healthcare system at the 3 hospitals, our outpatient clinics, and we have close to 7,500, 8,000 employees, and the testing, the positivity for asymptomatic test started at around 0.2%, and now it's closer to about 0.15%. So that's a very low. So that gives you some sense that they're not testing positive, we're doing something right, but at the same time we cannot let our guard down, and we have to continue to support our staff and make sure they feel comfortable in the workplace.
Oh, great job. Tara?
Someone has texted, what has the county been doing with the city, San Jose especially, to reopen City Hall, parks, community centers, libraries, etc.?
Well, let me take a stab at some part of this question anyway. The county actually has, by and large, kept its park system open, 48,000 acres of parks. There have been some areas or particular specific activities that were shut down for a while. Most of those were opened up last week, and on the county side, and the city has just started to open up places like Elm Rock Park, which is over 700 acres of parkland, in the Elm Rock foothills, surrounded by development. I'm not sure what we're doing directly in terms of trying to urge or encourage the city to open up, San Jose particularly, to open up some of its community centers and things like that at this point. Some of those things in a city that's a little more compact than a rural, outlying area of a county, I think their problem is the same thing that we were talking about with the schools and, in general. If you open up a community center, how good is that going to be if you can only put a few people in? And who do you turn away? And how do you afford all the PPEs and everything that you would need to have a few people, come into a recreational center or a community center for activities? So I think they're struggling with that. We're all struggling with that. But I will say this, you should know that our board president, Cindy Chavez, and one of our other board members, they meet 3 times a week with the Emergency Operations Center folks,
Right.
And they communicate multiple times a week with the mayor of the city of San Jose. So there is coordination going on. There's communication back and forth, and it can probably always be better, but I try to remind people we're in a pandemic. We had a work plan this year at the county that did not include a pandemic, and it would have kept us all very, very busy without a health crisis, and I'm sure they feel that way at the city of San Jose also. And we got declining resources now, right? You're trying to put a budget together for those hospitals for this year, and I know the county executive's asking you to cut because the tax revenue is coming in a lot less. We see
Right.
that.
There's no doubt that we see businesses struggling, hospitals and the healthcare systems out there, even community health providers, physician offices are struggling. And it's really important that we understand that in the end, if we don't have healthcare for a community,
Especially in a health crisis.
particularly in a health crisis, then we have bigger challenges that we're going to have to deal with. I think the federal government has done somewhat of a good job in getting dollars to where they need to be to support hospitals. Clearly, we can always do better there, and they can do better in working with us. But the bottom line is that as a county, we've received some of that funding, and that will help us get us through the current year. Where we will be next year, there's a lot of variables there, but it's important to understand that things are constricting in terms of resources, and we have to find better ways of providing health care and be more efficient. Yeah.
And those federal dollars are not going to be able to go on forever. Right?
No, they're typically known as one-time funding, and they do not go to help with a structural deficit, if you will. When your ongoing operating revenue, they're not keeping pace with your expenditures.
Tara?
So a texter asks, when can gyms open? And Christina online asks, what about nail and hair places?
We've received a tremendous amount of positive and I suppose a little bit of negative testimony, but a lot of good ideas. People from salons and gymnastic programs, swimming programs, amateur sports programs basically came to a set of hearings that we had just last week, starting a week ago Friday through Monday, and testified before the Board of Supervisors on a virtual meeting, a Zoom meeting, which was handled, I thought, very well by our board president, managing to get through all that testimony. The attorneys for Sarah Cody that are supporting her to write these new rules, they were taking notes and they were listening as to essentially they're always trying to get ready and get their documents ready. They're writing to get documents ready to open up to the next phase. And it's a little, I am rooting for the salons and for those sports activities, youth and adult sports activities. Obviously, they have to be regulated really significantly. We've seen now best practices on hairstylists and barbers and so forth coming from other states. It's amazing what they have to do. I'm not sure all of the shops here will want to do that kind of stuff. They can't have a waiting room inside. Everyone has to wait outside 6 feet apart for their appointment. They don't, in some states, they're not even allowing walk-ups at all. You have to have an appointment, and a lot of shops aren't used to operating that way. Everyone has to wear a mask inside. Even if the chairs are 6 feet apart naturally, they are cutting the capacity down by 50%, so it's every other chair. They are requiring, beyond the normal sanitization of the clippers and things that they use, the tools that they use, a much more robust sanitization or sterilization of things. I got done reading. It took me 5 minutes this morning to read the rules for one of the states that opened up hair salons this morning. And I read pretty fast. When I say 5 minutes, was probably this many pages of rules. And I thought, there's got to be a lot of salons that look at those rules when the day does come and really question whether or not they can make ends meet, whether is it worth it to open up. And I think this is, you were calling it the new norm or the new normal. Unfortunately, this is a reality. But I do think that we are very close, my opinion. I don't have any inside information. Paul, I don't think you do either. But I think between the attorneys and Sarah Cody herself, what we're seeing come out of the state, that if these numbers continue to stay level or flat, that we're very close to seeing that next leap ahead, opening up some of these activities that have still been held back. But just be aware, it's not going to be, like walking in 2 minutes before you want your haircut anymore. The rules are going to be a lot different. And I want to say I am personally very grateful to the small business owners out there in both of those areas for working as hard as they have been to get us their best ideas on how to make things work. I mean, some of the very best ideas all along have been coming from the business community. They've been telling us, we know our businesses, we know what we're capable of doing. Please get this information to Sarah Cody, and part of my job is to make sure she gets that information.
And I would just comment that I know you mentioned the attorneys that helped Dr. Sarah Cody in trying to craft the language, and Dr. Cody's watching the numbers and trying to figure out timing and what's right and safe for the community. Dr. Cody takes this very seriously, and she understands the impact this has on these small businesses. I think she draws the connection from the fact that many of these small businesses are individuals that depend on this for their livelihood. And I think she takes that into consideration, and she is working together with some of the best minds to make sure that we do this right.
Well, and the hardest thing, I think, probably in your position as a CEO and as a parent, you learn to really resist saying, I don't know. You want to know, My son asked me a question. I take great pride in being able to give him the answer. And, we're in this period right now because of all the moving parts that even though we can sense, we see the pattern, we see every couple of weeks, and it's already been 1 week since the last activities opened up. If the pattern stayed the same, in another week, more things will open up. The public health officer will open some more up, but we don't really know until we get to that end of that 2-week incubation period, how things are going to play out and what she's going to tell us we can do. So we're all waiting. Even the government officials are waiting, and please hang in there, because we get it. We don't want to lose businesses, and we know that those of you who haven't opened up are struggling. We know it. I come from a business background myself. I still have businesses, and I have close business acquaintance or affiliates that are struggling mightily. So there's nothing we would like more to open the rest of the businesses up and get the tax revenue in, right, Paul? Because we need the tax revenue, but we also don't want these deaths to start going up to double or triple digits again every week. So we have to work with what we have here. Tara, is that it for now? All right. So, Paul, I just want to ask you: are we at wrap-up time? Okay, man, thank you very much. So our producer is telling us that we need to wrap up now, but why don't you close it out for us, Paul? And I just said my couple of words here of gratitude to the business community. We don't bang pots and pans and make a bunch of noise like they do in New York at 7 o'clock every night for our healthcare workers, but do they deserve that here, your employees?
Well, I think not only do our healthcare workers, not just the doctors and nurses and the support staff, but I have to say that it's just not about the healthcare community. I think we know that it's about our entire community, and our staff know that. So whether it's of course law enforcement, but also the frontline workers that are throughout our community in the stores, the delivery drivers, et cetera, all of them make a difference in this, and it's really important that we take care of ourselves, and so we can take care of others.
Yeah, well, and we need to show as much gratitude as we can to those people who are putting themselves in harm's way. So
Absolutely.
Thank you to you and your system and those thousands of healthcare workers in the county that are trying to keep people as safe as possible. We appreciate you being here today.
Thank you for your support.
Thank you.